بسم الله الرحمن الرحيم إن الحمد لله رب العالمين والصلاة والسلام على أشرف الأنبياء والمرسلين وعلى آله وصحبه ومن تبعوهم بإحسان إلى يوم الدين وبعد. Bismillah. Alhamdulillah, you're all here, or at least some of you are here, the ones that got caffeinated early. We're going to go ahead and get started. Sheikhuna Abu Hatem, Abu Bara, yes. I was asked to emphasize one other aspect of the arrangements of the room. 16 and up. Anyone younger than 16, we do ask that they are allowed to do things outside of the main conference hall so that we can maintain our focus, inshallah, on all of the presentations that will be given. So, briefly, just an introduction to myself. Not that I'm very important, but I'm your brother, Abu Suheil Saeed Purcell. I am the outreach coordinator for the Islamic Center of Irving in Irving, Texas, north of here about 2 hours or so. And we're going to be beginning with our brother Abu Bara, Sheikhuna Dr. Hatem Al Haj, Hafidahullah. He will be presenting on Muslim providers prescribing forbidden drugs for non-Muslims. And the papers are available in English, Arabic, and dual English and Arabic for those who are interested in looking into the research. Hopefully you've all done that already, of course, right? So we're going to go ahead and begin. The Sheikh will have 20 minutes to present his paper, 5 additional minutes if any details need to be clarified, and then we'll open for Q&A. Q&A is going to be very strict. Questions will only be taken at the microphones. We have one on our right, one on my right, your left, my left, your right, and then one for the sisters over here, I believe. The order will be right, left, sisters. This is according to the instructions I've received, just so everybody's clear. I'm not playing favorites. This is the instructions I was given. So questions will be limited strictly to 90 seconds. And they must be done from the microphone, no comments from the floor. Answers by the shuyukh will be 4 minutes. Again, also strictly enforced. And then we will endeavor to end on time so we can keep the day flowing and get to everything on time and everyone can finish on schedule, inshallah. واضح؟ طيب. تفضل يا شيخ.
بسم الله الحمد لله والصلاة والسلام على رسول الله وعلى آله وصحبه ومن والاه ثم أما بعد to proceed. So I was asked to write this paper about Muslim physicians prescribing haram medications or impure substances, etc., to non-Muslim patients. And I have the paper written in English and Arabic. I'm not quite sure if you have it in your book, but you have it in the PDF files. The English is across from the Arabic. So it's one of the PDF files has it side by side. So I will try, and I was told to present in English, but since the paper was written first in Arabic and then translated into English, so I'm just going to mix my presentation. And at any rate, 20 minutes is not enough to present the paper any sort of detail. So I will be basically giving you the structure of the paper, the outline of the paper, and may read some statements from the paper that may encapsulate the essence of the paper. So here is something that I wanted to read to you from the introduction about the outline of the paper. So I wrote here in the introduction, after الحمد والصلاة, فإن موضوع تطبيب المسلم لغير المسلم ليس بجديد ولا العكس، فإن صناعة الطب من المشترك الإنساني الذي لا ينبغي أن يقف عند حدود الدين أو العرق أو غيرها، وما زال المسلمون وغير المسلمين يطبب بعضهم بعضا، ولكن كان الأكثر في بلاد المسلمين تطبيب غير المسلمين للمسلمين، ومن ثم لا نجد للفقهاء كلاما مفصلا عن قواعد تطبيب المسلم لغيره، ولعل من أسباب ذلك أيضا أن المرض سبب للتيسير، ومنها أن كثيرا من فقهائنا لا يرون دين المريض مؤثرا فيما يحل للطبيب ممارسته، لأنهم يرون غير المسلمين مخاطبين بفروع الشريعة. So why is it that we don't have detailed instructions about Muslim physicians treating non-Muslim patients, and basically whether there are any differences between treating a Muslim or a non-Muslim patient? Because although Muslims and non-Muslims have been treating each other forever, but in Muslim countries in the past, it used to be more often that non-Muslims were treating Muslim patients versus Muslims treating non-Muslim patients. And you may refer to the statement of Imam al-Shafi'i when he lamented the fact that we gave up 1/3 of knowledge to the Jews and Christians when we not abandoned completely the science of medicine, but when we fell behind in the science of medicine. So he lamented the fact that we have gave up 1/3 of knowledge to the Jews and Christians. Another reason why this issue has not been addressed in great detail is because of the assumption that there should be no difference between Muslim and non-Muslim patients. One, because medicine is a shared human endeavor and religion should be inconsequential. Two, because many of our scholars felt that non-Muslims are being addressed by the furu' of the Sharia or the detailed rulings of the Sharia, just like Muslims are. So there is no point in the distinction between a Muslim and a non-Muslim patient. But is there a point to distinguish between a Muslim and non-Muslim patient? The Muslim patient wants you to prescribe things that don't have any porcine ingredients in them. Well, the non-Muslim patient may not care about this, and there may be times where they're asking for a modality of treatment or intervention that you believe to be impermissible. Should you force this on them, or can you basically provide that type of service, that type of medical intervention, or that medicine to them since they don't consider it haram? So basically, مدارك هذه الأحكام, I would say later, وقد رأيت أن مدارك الحكم في هذه القضية يمكن اختصارها فيما يأتي. هل الكفار مخاطبون بفروع الشريعة؟ وهل تجوز إعانتهم على المعصية؟ وما هو ضابط الإعانة والذرائع التي تسد؟ وهل للدار أثر على تلك الأحكام؟ وهل للحاجة وعموم البلوى وعسر الاحتراز أثر؟ فقسمت البحث 6 أقسام: مقدمة و5 مطالب، فإليك عناوينها. ما هي الأدوية والعلاجات المحرمة وما هو نوع التحريم؟ هل الكفار مخاطبون بفروع الشريعة؟ وهل تجوز إعانتهم على المعصية؟ وهل للدار أثر على تلك الأحكام؟ وهل للحاجة وعموم البلوى وعسر الاحتراز أثر؟ وما الحكم في التطبيقات المختلفة؟ So basically, if we have to look at this issue and we have to examine the rulings of prescribing haram medications and haram medical interventions, the paper is not only about prescribing haram medications like impure substances or alcohol mixtures or things of that nature, but the paper is also about prescribing or performing procedures that are not particularly halal. There are many procedures that we can talk about that may be problematic, may be controversial, may be clearly haram, or at least controversial. So I say here that I believe the considerations for this ruling can be summarized as follows. Are non-Muslims bound by the detailed practical rulings of Sharia? Is it permissible to assist them in sin? What are the guidelines for such assistance and the means to evil to be blocked? Does the abode wherein the act transpires influence these rulings? And do necessity, widespread hardship, and difficulty in avoidance play a role? So I have divided the paper into an introduction and 5 different topics. And the topics are about these particular considerations, in addition to a final topic on the rulings in different applications. So the first مطلب المطلب الأول ما هي الأدوية والعلاجات المحرمة وما نوع التحريم. So the first topic was about the forbidden medications. And in this particular topic, I address the different types of prohibitions when it comes to medications. Of course, there is some disagreement between the scholars with regard to using haram medications. That's for Muslim patients. We're talking here about the use of haram medications in general, whether the patient is Muslim or not Muslim. So there is a difference between the scholars, and the difference can be traced back to their interpretation of Hadith al-Uraniyin. You know, al-Uraniyun, when they came to the Prophet ﷺ and he prescribed for them camel's urine, to drink camel's urine. Okay, so when the Prophet ﷺ prescribed camel's urine for al-Uraniyin, what does that mean? It meant to the Hanafis and Shafi'is an exception from a prohibition, because camel's urine to them is prohibited. It is impure, and this was an exception because of the need for treatment. So it's a medical need that would allow them to use this impure substance for healing. But for the Malikis and Hanbalis, they did not consider camel's urine to be impure. That's bawl ma yu'kal lahmu. So they didn't consider this to be impure. This would have an impact on the entire, basically, discussion about the prescribing prohibited substances between the Hanafis and Shafi'is on one side, because they seem to be more lenient in this regard, and the Malikis and Hanbalis on the other side, because they seem to be stricter in this regard. The root of this difference in leniency and strictness between the madhahib is their interpretation of Hadith al-Uraniyin. If you believe that camel's urine is impure and the Prophet ﷺ prescribed it for healing, then you will believe that the exceptions should be made, and using impure substances and haram substances to consume for tadawi is permissible in certain cases. Now we have a clear hadith from the Prophet ﷺ where he says, "Tadawa wa la tadawa biharam." Seek treatment, but don't use haram for treatment. Don't seek haram treatment. And he said, "Inna Allah lam yaj'al shifaa ummati fi ma harrama alayha." Allah did not make the cure of my ummah and that which He prohibited for it. Hadith Tariq ibn Suwaid, when he said to him that when he was informed that he makes wine, and he said, "I only make it for medicinal uses. I don't make wine to drink for medicinal uses, for tadawi." And the Prophet ﷺ said to him, "It is not a cure, it is a disease." It is not a cure, it is a disease. So it's not like the Malikis and Hanbalis don't have backing for their position that basically the use of haram substances is not permitted. The Prophet ﷺ seems to be explicitly saying in a genre of a hadith that you should not use haram substances for treatment. So how did the Hanafis and Shafi'is address this? They said that this would apply if there is no necessity, if there are alternatives, or if there is no necessity. There is no necessity if there are alternatives. It's like, when people tell you, like if you drink a couple of beers a day, that would be good for your kidneys or something like that. So everybody would agree that this would be haram and it would not be permissible at all. But if you have if you have a particular disease for which there is no halal treatment, but there is a treatment that comes from porcine ingredients or whatever ingredients that are haram, should you be able to use those treatments? The Hanafis and Shafi'is said yes to this. Now, if we try to figure out a point of agreement between them, and then we branch off from the point of agreement, the Hanafis and Shafi'is in general, everybody will say that if you have a halal alternative, then treatment is, using a haram alternative would not be, or a haram medicine would not be warranted or sanctioned. But if, so this is something that they agree on. And that's like for a Muslim patient will always need to ask their physician if they prescribe something for them with dubious ingredients. The Muslim physician will need to ask, is there a halal alternative? If you are told that there is no halal alternative, then according to the Hanafis and Shafi'is, it would be permissible. Do the Malikis and Hanbalis categorically prohibit? No, they just say that using haram substances for treatment is not permitted. But then there will be a discussion about how much of that substance has been used. Is it a trivial amount? Is it mustahlak, meaning it has been thoroughly subsumed in the mixture? And there will be other questions. So very, very likely, the majority of scholars, particularly with modern medications, the majority of scholars will tell you it is halal to use that medicine when an alternative is lacking. The vast majority of scholars will tell you it is halal. Now, one thing that I wanted to point out is that pure alcoholic beverages, that's not pure alcohol, because pure alcohol, what does pure alcohol mean? 100% ethyl alcohol, that doesn't happen. Alcoholic beverages would have like a percentage of somewhere between 1 to 15% with anaerobic fermentation, and you need distillation and you need other ways of basically processing to have a higher percentage of alcohol in the drink. But at any rate, beverages that are considered intoxicant beverages, khamr, pure khamr, not alcohol mixtures, but pure khamr, whiskey, stuff like this. This in particular is restricted and prohibited by the very vast majority of Muslim jurists. Are there still some disagreements in certain cases? In our times, there should not be any exception. We're still in the introduction, by the way. In our times, yeah, but that's fine. I told you, it's just I'm gonna basically share with you the outline of the paper. It's impossible to. Okay, so in our times, it is a categorical prohibition. There are no scenarios where the use of wine, the use of khamr, let's say khamr, so that I don't get into trouble with translation. So khamr is categorically prohibited for medicinal purposes in our times because there is no scenario where you could imagine that it's the only thing available for whatever purpose you want to use it for. You may think in the past, like 400 years ago, if you needed to cut off a foot or a hand or something, and he gave the patients some khamr to numb their sensations a little bit so that the amputation happens more sort of safely and less painfully, then that would be the only indication. Nowadays, that indication is not applicable anymore. So just khamr categorically prohibited. We're done with that. All the discussion is about impure substances, like substances that come from pork or other impure substances. The thing that I wanted to say also is that it is not only about medicines or pharmaceutical products, but it is also about other types of intervention. So I say here in the introduction still, كل ما سبق كان عن حكم المداواة بالأدوية النجسة, or this is the first topic, not the introduction. I'm sorry, I'm actually doing better than, but this is the first topic. So كل ما سبق عن حكم المداواة بالأدوية النجسة والمحرمة والأمر فيها خلافي كما رأينا سوى الخمر الصرفة، فإنها وإن وقع فيها الخلاف إلا أنها مما اتفقت على المنع منها كلمة الجماهير العظيمة من أهل العلم وهو المؤيد بالأدلة. لكن مع تطور الصناعة الطبية ظهرت أنواع أخرى من العلاجات ومنها ما يقع الخلاف فيه كبعض عمليات التجميل والإجهاض قبل نفخ الروح، ومنها ما يقطع بتحريمه كعمليات تحويل جنس الأصحاء والإجهاض بعد نفخ الروح مع عدم وجود خطر على الأم، ومنها ما يكون المحظور أمرا من خارجها كتلقيح ببويضة امرأة بمني غير صاحب فراش. So I mentioned here some medical interventions that may be problematic, like abortion, for instance, before and after 120 days from conception, post-conception. Keep in mind, this is not 120 days of gestational age. That's what the doctors will tell you. That is 120 days post-conception. There is usually a 2-week difference between these different types of dating. Islamically, our dating starts from conception. That's usually 2 weeks after the first day of the last period. That's how the doctors started their dating. Okay. So abortion before 120 and after 120. And like I said before, as a Muslim, how you figure what Islam says is by starting with the four madhahib, and then the mu'tamad in the four madhahib, then other positions within the four madhahib, then positions of independent scholars outside the four madhahib. You don't basically refer to Republican or Democrat propaganda to figure out the Islamic position, or you don't decide on the Islamic position after extensive research by a qualified researcher. So abortion for us is it's don't get basically caught into the public debate without figuring out what Islam actually says, and never say Islam says such and such based on your Hanbalism, Malikism, Shafi'ism, or Hanafism. Islam is bigger than any madhab, but based on your extensive research of the agreement of Muslim scholars. And anyway, so what about transgender surgery? Yeah, that's done. Okay, sure. Okay. Well, anyway, so you will go through the paper, and basically the second topic is about whether the non-Muslims are addressed by the details of Sharia, because it's consequential. If the non-Muslims are addressed by the details of Sharia, you will, and certainly I go into this in much detail in this paper, because it is an important subject to investigate. Are non-Muslims addressed by the details of Sharia? Certainly the majority would say they are addressed by the details of Sharia, but we have 6 different positions. You could read in the paper the 6 different positions. The main ones: addressed, non-addressed, and one in the middle, addressed by some and not others. And maybe we can summarize what they want to say. This position in the middle, Imam Taymiyyah is Taqiyuddin Ibn Taymiyyah rahimahullah. He upholds this particular position in the middle. It is somewhere between the Hanafi position that they are not addressed and the Jumhur position that they are addressed. He says that there are indications in the Sunnah that they are not addressed with everything. At least he mentions the fact that Umar ibn Khattab gave a silken robe that the Prophet ﷺ had given him to his mushrik brother in Mecca. And that is basically an acknowledgement that they are not addressed by certain things. And what are the things that they are not addressed by? The paper talks about the distinctions between that which they are addressed by, that which they are not addressed by. It is not completely accurate, but you may say, the haram, things that are haram for themselves, not as a means to other haram, and things that would be universally considered sinful by people of, regardless of the different shari'ah, regardless of the different shari'ah, things that would be considered sinful based on divine wisdom. And they would not be different in the different shari'ah. They are addressed by all of those. And then the issue of the dar and whether the abode, whether the place of residence has any effect on these rulings. And I do also discuss the controversy here between the Hanafis on one side and the Jumhur on one side. May Allah bestow mercy on all of them and preserve those who are alive. But I discussed the debate, and then my preferred view is that the dar does not have an impact on halalizing or permitting haram contracts and haram interactions. However, the dar does have an impact, some impact. The exact impact that the dar has, I discuss, and this is even acknowledged by Shafi'is and Hanbalis who rejected that the dar would have an impact in theory, but then in application, they do recognize sometimes that the difference in abode does have some impact. And then, the other issues, necessity and difficulty of avoidance, widespread hardship, all of these things, do they have an impact on the ruling? Yes, they do have an impact. And finally, the final thing that I talk about, which is basically the conclusion of everything, based, I say here, بالرجوع إلى الترجيح في المطلب الثاني واستحضار الترخص من المطلبين الثالث والرابع، يظهر لي والله أعلم جواز ما يأتي في الممارسة الطبية خارج بلاد المسلمين بخصوص المريض غير المسلم. كل ما وقع فيه خلاف معتبر بين أهل الإسلام فلا يلزم حمل المرضى غير المسلمين على ما ترجح عندنا، وهذا يعني بناء على ما تقدم كل دواء نجس لا بديل له سوى الخمر الصرفة جاز للطبيب المسلم وصفه لغير المسلم. حل وصف معجون الخمر الكحول، حل وصف المخدرات والماريوانا وغيرها متى التزمت القوانين وروعيت المعايير المعتبرة عند أهل المهنة. حل المداواة بسماع المعازف، جواز كل عمليات التجميل التي وقع فيها الخلاف، جواز الإجهاض قبل نفخ الروح وهو عند 120 يوما عند عامة العلماء. كل ما لم يكن محرما بإطلاق في كل الأحوال، ومن أمثلته ربط قنوات فلوب فإنه سائغ في بعض الأحوال دون بعض فيحل فعله عند طلب المريضة. الجراحات الوقائية يجوز عملها لطالبها لاختلاف النظر في تقدير المصالح والمفاسد. التلقيح الصناعي لبويضة بنطفة من غير صاحب فراش، وذلك لصعوبة التحرز ولعدم إمكان الاستفصال من أحوالهم والتثبت من شرعية العلاقة، بل من المسلمين من لا يسجل زواجه. والتلقيح الصناعي مما يحل أحيانا فلا معصية في عينه كقطع عضو صحيح مثلا من غير سبب. I have 1 minute to say what are the haram things. If you don't want the haram things, that's fine.
So just so everybody's clear, we're going to allow the Sheikh to go ahead and finish this last point. Because of that, we will not be able to take questions at this time in order to stay on schedule, but there is an open session at 11:30 where you can ask all your questions about this and other presentations, inshallah. واضح؟ طيب.
Okay. ويحرم الكذب على المريض وتضليله كتشجيعه على تحويل جنسه مع عدم وجود خلل عضوي أو الاستمرار في علاقة محرمة، مثلا تغيير خلق الله وقطع عضو صحيح من غير سبب، ويدخل في ذلك عمليات تحويل الجنس للأصحاء بدنيا. وصف الخمر الصرفة وهذه ليست دواء في الشرع ولا في الطب. المساعدة فيما يدعى القتل الرحيم. التلبس بمباشرة الحرام أو المحرم، فلو حرمنا استعمال الكحول مثلا، لو حرمنا لما جاز للمسلم تطهير الجروح به لأنه يتلبس، ولكن الصحيح جوازه مع المسلم وغير المسلم. وهذه المحرمات قد يباح بعضها لمسيس الحاجة بفتوى خاصة من هيئة علمية. Translate. Or you want me? Okay, so very quickly, to not be unfair. in revisiting the preferred position in the second topic and considering the dispensation from the third and fourth topics, it appears to me, and Allah knows best, that the following is permissible in medical practice outside the lands of Muslims with non-Muslims. Debated matters for any issue that has notable disagreement among the scholars of Islam. It's not obligatory to impose on non-Muslim patients what we consider more reliable. Based on the prior discussions, this implies every impure medicine, with the exception of pure wine, or pure khamr, let me say, is permissible for a Muslim doctor to prescribe to a non-Muslim. The prescription of alcohol-based mixtures is permissible. The prescription of narcotics, marijuana, and the like is allowable as long as legal regulations are adhered to and recognized professional standards are maintained. Treating with music therapy is permissible. All cosmetic surgeries, لأن الشافعية أجازوه. All cosmetic surgeries where there is disagreement are permissible. Abortion is permissible before the soul is breathed or before ensoulment, which happens, or which, according to the majority of scholars, is at 120 days. Matters? Okay. The haram ones, you can.
طيب. جزاكم الله خير وبارك الله فيكم شيخنا. As I said, there is no time for questions right now. Inshallah, Dr. Suheil, هو موجود inshallah. صح? So, like I said, there is an open session between 11:30 and 12:30 for you to ask all your questions. And in addition, Dr. Hatem, Hafidhullah, he has a couple additional papers to present. One of them that is in Arabic only is specifically on some aspects of the substances, and a lot of the papers actually reference that particular paper in their papers. So I encourage you to read that and to come for the session. That is, I think it might be later today actually, to gain more insight and to have additional information before you formulate your questions, inshallah. So, alhamdulillah, next up we will have our brother Dr. Suheil, Hafidhullah. He will be presenting on gender identity issues, transgenderism, sex change treatment, gender identity and dysphoria, and gender change issues presented to a Muslim physician, transgender treatments, initial treatment, maintenance, and management of patients. Alhamdulillah, I was able to read through his paper. I'm not going to try and steal his platform, but I do want to highlight one aspect of his paper towards the very end where he talks about pastoral issues. I very much encourage you, if you do not get a chance to read the whole paper, please look at the last part on pastoral issues. He makes some incredibly relevant and very thoughtful points regarding the care for individuals that are having these sorts of struggles and issues and how to approach them in a way that honors where they're at, as well as still helping to guide them towards the haqq, inshallah.
Alhamdulillah, wassalatu wassalamu ala rasulillah. We'll begin by thanking the organizers and mashayikh for that they thought highly enough of this Tuwaylib to invite me to present on this. And I'm honored to be here in the presence of the senior mashayikh and all of you. Secondly, I want to acknowledge Dr. Abdullah Al-Judi, who is my co-author for this paper. He lives in Saudi Arabia and he was not able to attend because of his personal circumstances. Okay, so this is the outline of the paper. I moved a few things around for the purposes of the presentation, and I will try to cover the major points. So we have two parts. We have first part, the preliminaries and background on what is gender, what is sex, what is the history of this developments in this field in the West and in the Islamic world, and then the religious dimensions. Then the fatwa on this, issue. Is that better for the volume? Everyone care? At the back, can you hear me? Okay. So the hukum, the ruling on the surgery itself, as well as consequent issues, and then pastoral guidance, and then also in the paper there are some additional resources which could be useful. So the paper started out by talking about sex determination and sex differentiation. So I don't want to go into too much detail here, but maybe just to select a few points from here. So we start at the chromosomal level. So we have the female as XX, male as XY. This is something which happens at the time of conception, at the time of fertilization of the ovum. So from this aspect, sex is fixed, either male or female. Yes, there are XXY, XYY, and so on, but those are some ambiguous conditions which we will say more about shortly. And then as the pregnancy progresses, the gonads, the glands, sexual glands form, and then in the case of the male, the testosterone hormone is secreted. This leads to the development of the male genitalia, male sexual organs, both internal and external. And then the final dimension of this is something that happens or that can happen after birth. So there are legal, educational, psychological, and social factors coming from culture, media, and so on, which have a role in shaping the person's, you can call it identity. So it might be that there is someone who is from the anatomy, he is unambiguously male, internally and externally, but he chooses to identify as a female and to behave like a female and so on. So we are just describing, you are not endorsing. This is what is out there. Okay, so as we said, on the chromosomal level, sex is binary. Only two possibilities, either you are male or female. And the presence of the Y chromosome implies that you are male, regardless whether you are XY, XXY, XYY, you are considered male. Yes, there are ambiguous cases where people have a mixture of sexual organs or secondary characteristics. So basically on the biological level, if any of the genes involved in the biological processes, at the top of that list, disruption on this level could lead to anomalies or disorders, what are called, it could lead to what was in the past called the intersex condition or sexual development disorder and other terms. So this leads to a combination of female and male traits in the same body. So if a person undergoes surgery for this type of condition, which involves pharmacological aspects, drugs, and potentially also surgery, typically this is carried out in early childhood. This is halal by the agreement of the fuqaha, because the goal here is to align the outward and inward, potentially, but to align the anatomy with the underlying sex of the person. This is sex correction. We should distinguish this from something else, which is sex change or sex transition. This is the case of someone who is genetically and anatomically unambiguously male, internally and externally, or unambiguously female. But this person has an overbearing feeling that they do not belong to their apparent sex. So this sort of treatment is performed nowadays, and we refer to this as sex change treatment, hormonal and or surgical interventions, and according to the vast majority of fuqaha, if not by ijma', this is haram. Okay. In Islam, as a reminder, we have the concept of two sexes. يَهَبُ لِمَنْ يَشَاءُ إِنَاثًا وَيَهَبُ لِمَنْ يَشَاءُ الذُّكُورَ. That Allah gives male children to whom He wills, and female children to whom He wills. And there are other verses also which are on this same topic. So only two sexes, male and female, only two genders. For fiqhi purposes, sex is the same as gender. And the concept, the modern concept of gender as distinct from sex is precisely that, a modern construct. It is something that emerged very, very recently. But as we said, we do have the khuntha, the intersex person, the person who has both male and female organs, or neither. So what is the ruling on the khuntha? If one set of organs is dominant, then the khuntha would be considered member of that sex. If the male organs are dominant, for example, if the person urinates from the male organ, not from the female, then he is considered a male. There are other considerations. If khuntha becomes pregnant, they are considered female, and so on. In the absence of the above, the khuntha word could be taken. To ask the khuntha, are you attracted to men or women? If they say attracted to men, they are considered to be female, and vice versa. Yeah, there is a dissenting opinion, or kind of slightly different take on that from Imam Shafi'i, which you can read about in the paper. But moving on to the history. So Magnus Hirschfeld died in 1935, was the first to offer hormonal therapy and surgery for transsexuals. And he was also at least one of the first people to make a distinction between various terms. So I think it is important for all of us to be aware of these terms and not to confuse and conflate these terms, because we will be doing a disservice to our communities if someone comes to you with a problem and you kind of mislabel what his problem is. So, homosexual is someone who feels attracted to the same sex. Is homosexuality a sin? To have these feelings is not necessarily a sin. So we should be careful about saying homosexuality is a sin without clarifying further. Yes, it is a sin to act on those homosexual desires. Then two other terms, transvestite is a cross-dresser, man who is dressing as a woman or vice versa. Transsexual is someone who wants to physically be like the other gender, man who wants to be physically like a woman, right? To have breasts and to have a softer voice and so on. Then 1949, David Oliver Caldwell also made a distinction between psychological sex, no, not also, because I guess Hershey would don't do that, psychological sex as distinct from biological sex. So as you can see, this is within the last 75 years. But he, unlike Hirschfeld, called for psychological treatment only, not any drugs, not any surgery. Okay, enough for that. Then developments in diagnosis. So American Psychological Association, APA, in 1980 listed this transsexualism as a disorder in the DSM-3. In 1994, they renamed this from transsexualism to gender identity disorder. And recently, 2013, I guess 10 years ago, they again renamed this to gender dysphoria in order to remove the stigma from people who have this. But at the same time, if you say there's nothing wrong with it, then it is not a medical condition, so insurance will not cover those who want this surgery. So they relabeled it to remove the stigma, but at the same time, they said it is still a medical condition. But now it is, according to them, based on the right to choose. So if someone is suffering from this distress and anxiety and so on, suicidal tendency, he under US law, he has the right to choose to undergo this surgery. But also in 2013, they said that gender dysphoria includes people who are intersex. So this, from the fiqhi perspective blurs the picture, because as we said, for intersex people, this surgery is permitted, otherwise it is haram. Okay. The Muslim world, we have some discussions of this in the late 1900s, and then this issue came to the fore in 1982 when a student at Al-Azhar in Egypt, whose name was Sayed, decided to transition after consultations with a psychologist and so on, to become female, and he took the name Sally. So Al-Azhar refused to admit him to the men's section, but they also were not willing to admit him to as a female student. So there was extensive coverage in the media. The courts got involved. Some fatwa were issued, and some of the fatwa around this time were ambiguous, such that you have the same fatwa. For example, the fatwa of Jad al-Haq and Tantawi. Both sides were using these fatwa to support their position. What is involved in someone who wants to transition? First of all, there's diagnosis and therapy by psychologists or psychotherapists. Basically, they want to rule out mental, psychological, and hormonal disorders, and also to make sure the patient understands what is involved if he or she decides to go ahead. That is in theory, but as I mentioned later, in practice, they often fall short in this step. They often do not give enough information to the patients to allow them to make an informed decision. And as I mentioned later on also, maybe this is at least one factor why some of the people who undergo the surgery go on to regret it. Step 2 is social transitioning, where the person will dress as the other sex and maybe take a new name, live as the other sex for at least 1 year, and so on. Then there is hormonal therapy. Typically, ideally from, at least according to their perspective, it is started at a young age, before puberty, in order to block the hormones of the actual sex, and then to artificially administer hormones of the other sex. And then some people will go on to the 4th step, which is surgery. And within the surgery, there are different options leading to partial or quote-unquote full change. Okay, the cost of this are quite a lot. Basically, 3 types of cost. Pre-surgery costs, the psychotherapy, counseling, hormonal therapy, lifestyle change. Of course, the person would buy if it is a man transitioning to woman, he would buy female clothes and so on. Then, secondly, these costs of the surgery. I have put up there some of the most common surgeries which people undergo, and some people undergo one of these, some people undergo more than one. So things like construction of the external private parts for the other gender, removal of the uterus, construction or removal of breasts, and so on. As you can see, the costs are very high, and typically for male to female transitions, the cost is even higher. Then thirdly, there are the post-surgery costs, which are ongoing for the rest of the person's life. Of course, there is a high rate of suicide among these people, both before surgery and after surgery. There's debate over whether surgery decreases the rate of suicide. From my limited reading of the technical literature, there is no clear-cut answer on that. I'm sure Dr. Hatem and others have more insight. Okay, now we come to the religious dimensions. So I have 18 minutes. So as we said, according to the vast majority of fuqaha, for someone who is not intersex, who is not of ambiguous gender, to have this sex change surgery is haram. What is this ruling based on? Quran, Sunnah, and Qiyas and reason. So starting with the Quran, the verse of Surah An-Nisa, part of the verse, فَلَا يُغَيِّرُنَّ خَلْقَ اللَّهِ, that Shaitan promised to mislead people in order for them to do various things, including that he will command them so they will change the creation of Allah. And some of the Mufassirin mentions some things here like tattooing and so on, which are much less serious or less drastic than sex change surgery. So if tattooing is included in this prohibition, then sex change surgery should be included, has even more right to be included. Another verse also, Surah An-Nisa, وَلَا تَتَمَنَّوْا مَا فَضَّلَ اللَّهُ بِهِ بَعْضَكُمْ عَلَى بَعْضٍ, that do not wish for that by which Allah has made some of you exceed others. This is not my own translation. But in any case, again, some of the Mufassirin mention here that this verse was revealed in connection with some women who wanted to have some of the status of men. Yeah, this verse is, we don't have time to discuss it more, and there are several interesting points in there. Moving to the Sunnah, there's the hadith in Bukhari and elsewhere, لعن النبي صلى الله عليه وسلم المخنثين من الرجال والمترجلات من النساء. The Prophet cursed effeminate men and mannish women. Right. But note that Imam Nawawi and others have pointed out that this applies to someone who does not have a choice, for someone who is naturally effeminate in his voice or his gait and so on, then he is not sinful. This applies typically to someone who is trying to imitate the other sex. Another hadith also in Bukhari and elsewhere, the Prophet ﷺ is cursing various types of people, including woman who tattoos herself. Again, I think we already touched on tattooing, and it's relevant to the verse on the previous slide. Another hadith, the Prophet ﷺ كان ينهى عن المثلة. He used to prohibit mutilation of the body, whether the human being is alive or dead, and to cut off parts of the body, the breast or the male organ. This is definitely a form of mutilation, and also there are specifically hadiths prohibiting castration. Okay, from analogy, Qiyas al-Awla applies to some of the texts we already mentioned, that if something we know to be prohibited, and then this other thing is a more drastic or higher level or form of that thing, then this other deed also is haram. So Allah says in the Quran, فَلَا تَقُلْ لَهُمَا أُفٍّ. Do not say to your parents, uff, don't even utter a word of annoyance or disrespect. Therefore, by this type of qiyas, it follows that it is haram to beat your parents. So tattooing is haram. So by qiyas, tattooing is haram, mutilation is haram, castration is haram. So by qiyas al-awla, sex change surgery for other than the intersex person should be haram. Also, it is unnatural. It is trying to change Allah's creation. There is a sort of deception. You are born a man, you're trying to be a woman, or vice versa. And of course, regardless of what change you make on the surface, your chromosomes are not going to change. Male, MTF, male to female transition, may have artificial breasts, but even though externally he looks like a man, his chromosomes are still male, XY. So it is a type of deception. Also, the surgery will have to involve the person exposing the private parts to the surgeon, and it is haram to do this without any necessity. Okay, so the fiqhi rulings, first of all, sex change itself, as we said, it is haram for other than the ambiguous sex person, the intersex person, khuntha and so on, according to the vast majority of fuqaha. Many fatwas in the paper, we quote extracts from them, starting from 1981, the Egyptian Darul Ifta, then the Fiqh Council of the Rabita, a few years later, the Hayat Kibar al-Ulama, Saudi Arabia, Lajna al-Da'ima also, Saudi Arabia, around 1994, and a couple of others. Most recently, the International Fiqh Academy of the OIC, agreed that this is haram for other than the intersex person. Is there any khilaf? Yes, there's some khilaf. but this makes this, as I say in the paper, مسألة خلافية, not مسألة اختلافية. So there are the fatwa of Jad al-Haq and Sayyid Tantawi, although as you said, they are not clear-cut. And it seems actually, especially that Jad al-Haq is not endorsing this surgery for other than the intersex person, wallahu alam. In the Shi'i world, Khomeini, the leader of the revolution in Iran, discussed this issue in 1967, and he apparently endorsed it, but even within the Shi'i fuqaha, this issue was controversial. One prominent Ayatollah, Ja'far Subhani, says that actually what Khomeini was talking about was a hypothetical issue. If a male, if it was possible for a male to transition to a female, then he would be considered a female from the fiqh perspective and so on. But Subhani said that actually this is hypothetical because even the sex change surgery is not changing the chromosomal sex. Okay, but because of this dissent or possible dissent, and also because of the flood of propaganda nowadays, we do not endorse the fear of those who, if a Muslim says that this surgery is haram, we should not judge him to be out of Islam. Okay. So one who does it knowing of the prohibition is a sinner. Right? Sinner does not mean kafir, of course, fasiq. The person who undergoes the surgery and also the Muslim doctor who performed the surgery, both of them are considered sinful. And after the surgery, the fiqhi sex remains unchanged, and therefore, female to male transition, this person cannot lead the salah for other men, cannot give khutbah, cannot give adhan, is considered female for inheritance purposes, not allowed to marry a woman, even though externally she is now looking like a man. And similarly, male to female transition, yes. So even though after the surgery he looks like a man, like a woman, really he is still a man who has mutilated himself. So, therefore, if he led the salah, it is valid. Yeah, my dear friend, Imam Dr. Asif texted me a few days ago on this topic and asked me what the reason was, and I replied to him. If anyone has question on that, I'm happy to answer that during the question-answer session. And then, yeah, some other practical issues. So, someone who has undergone the surgery, which bathrooms do they use? A woman who underwent surgery, so she is now looking like a man. It did not make sense to send her to the women's bathroom. At the same time, does not make sense to allow her to use the men's bathroom. So myself and Dr. Abdullah Judi and others whom we have discussed this with feel that it is best to have a private bathroom for these type of people. In the salah, where do they stand? Again, our view, there may be other views, but our view is, as well as the view of others, some others we consulted, that they should stand like the khuntha between the men and the women. Because even though he's not really a khuntha, he has, by means of this surgery, rendered himself a person of ambiguous gender. Pronouns, the default is that pronouns do not change after the surgery. So, but if you might get in trouble, you might lose your job and so on, if you, they call it misgender someone, then we believe there is room in the Sharia for using the person's pronouns of choice in order to prevent a greater evil. Pastoral guidance, inshallah, I can go a couple of minutes over. Thank you. So, yeah, important to stress that, as Sheikh Saeed pointed out at the beginning, we want to meet people where they are. We are not condoning what they do. We are not saying this is halal. But at the same time, to just tell the person this is haram, end of discussion, that is not really going to help. We need to do more. And as Sheikh Ibn Uthaymeen, rahimahullah, pointed out, we need to exercise wisdom. We want to bring this person closer to Allah, bring this person back to the right path. So, number one, I mentioned already, no takfir. So what should you do if someone from your masjid community comes to you and has this problem? Maybe a sister comes and tells you, I want to become a man. Number one, just listen to them with empathy. Try not to be outwardly judgmental. Yes, we know the hukum, it is haram. But if inkar bil lisan, to forbid the wrong with the tongue, leads to a greater evil, you should not do it. You should move to the inkar bil qalb. So often it will not be helpful to criticize this person too much. Just listen. These people have socialization problems. They have may have depression. Many of them have suffered sexual or other trauma earlier in their lives. Make them feel that they are safe talking to you. I'm pretty sure they know you as an imam, as a community leader. They know your stance. They know you believe this is haram. Probably don't even need to tell them. Just listen, allow them to express their feelings, their frustrations, their thoughts. Allow them to develop a relationship with you, and you are a symbol of Allah's religion. If they develop a relationship with you, that makes it easier for them to develop a relationship with Allah. In contrast to if you are very harsh with them, send them away, tell them not to come to the masjid anymore, this person is going to become even further from Islam, from Allah, maybe even leave Islam completely. Also, you can advise the person to reconsider his decision, even aside from the religious dimension, even from a purely pragmatic point of view. As I discussed in the paper, and I put the bullet points up there, and also finally make dua for the person. Imam Siraj Wahad, Hafidhahullah, when someone asks him to make dua, he makes dua for that person every day for 2 weeks. Okay, and so finally, helpful resources, they are all in the paper. To learn more, the two on the bottom, and practical resources. Cornerstone Counseling, I have given the website in the paper, please look it up. If you do have people who are in your community who are struggling with this, and who knows, maybe one of us is struggling with these issues. So Cornerstone offers Islamic perspective counseling, and then Brother Wahid Jensen has a podcast, a way beyond the rainbow. In particular, those episodes which I put there. هذا والله أعلم وصلى اللهم على سيدنا محمد وآله وسلم والحمد لله رب العالمين.
Assalamu alaikum wa rahmatullah. Jazakum Allah khair wa hafidhullah. I want to highlight the last part again that he was speaking about regarding the pastoral care. He referenced a lot of situations that we deal with. Myself being an outreach, I come across a lot of people when they're at a very transitional point in their lives. Many times they're dealing with issues similar to this or otherwise. Sheikh Jamal Zarabozo, Hafidhullah, he has a great paper on some mental health issues and how it relates to their accountability. A very interesting story there about a young brother that was struggling with Salah and the advice that he was getting and how it pushed him to a point of wanting to leave Islam, and a better approach possibly of addressing those sorts of issues, doing very much what Dr. Suheil was referring to about meeting them where they are and listening to them, without overt judgment, if you will, in order to allow them an approach, a wasila towards Allah through your efforts, inshallah, to help bring them back into the fold and deal with the trauma, the psychological trauma that they're dealing with. Now, back to the point at hand. We know we're about to start Q&A, 90 seconds maximum. And I will be very strict about that. We'll be starting with the right and left once more, and then from the sisters. Okay, there's the microphone. So we're going to go ahead and get started. The light is over here. In order so that I can keep things on time, I'm going to do it straight from here. 90 seconds. Tafaddal mashkura.
Assalamu alaikum. Real quick, so the dissenting views, the minority that did allow it, do they regard that gender change then to be treated according to that gender in everything that we mentioned, inheritance, marriage, etc.? That's the first question. The second thing is, regarding their leading the prayer, would it not be more appropriate to have the views of the fuqaha regarding can a fasiq lead salah or not in this issue instead of having a generic ruling? Barakallahu fikum.
Tafaddal. 4 minutes, inshallah, maximum.
Okay. So I think the first part of your question was about those minority who allow this. Is your question that for that minority, after the surgery, would they allow, would they treat the person male to female transition after the surgery, would they treat him as a female for inheritance and so on? Is what that's the question? Yeah, okay. Presumably, but I am actually not sure. I'd have to go back and check what they have written. Yeah, as I said, the fatwa of Jad al-Haq, the fatwa of Jad al-Haq is somewhat ambiguous. There are some ambiguous phrases in it, so it is questionable whether he actually has this view, and I think the same for At-Tantawi. If you want to look at the Shi'i fuqaha, then Khomeini, from what I understand, he did not go into much detail, and then it was the later Shi'i fuqaha who extrapolated from here. But yeah, actually in Iran is one of the top sites in the world for this type of surgery. Many people from all over the world travel to Iran for the surgery because it is legal there. So yeah, but I suspect that those Shi'is who allow this would apply the transition gender regulations after the surgery, but I would have to go back and make sure. If you want me to do that, please give me your email afterward, and I'll get back to you, inshallah. And the second question about the leadership of the prayer, yes. So this is, as I said, if the male to female, he was unambiguously born a male, internally and externally. Then he underwent surgery to become a woman. So as I said, if he leads the prayer, from my understanding, it would be valid because he's still a man. But that being said, I would not encourage him to lead. But why not treat him as a khuntha, as they said? Basically, by istishab here, this person is a man, he remains a man in the absence of certain proof to the contrary. So he's still a man who has mutilated himself. He's not a khuntha. Wallahu a'lam.
All right, left side, tafaddal.
Assalamu alaikum.
Can I just add one thing?
Oh, hang on. Yeah, go ahead.
I just want to say that the fatwa of Sheikh Jad al-Haq is ambiguous, as the Sheikh mentioned. However, the peers and disciples of Sheikh Jad al-Haq and everybody who knows Sheikh Jad al-Haq can swear by God 100 times that he did not mean the permissibility of transgender surgery. Anyone who knows Sheikh Jad al-Haq would know that. He did not mean the permissibility of transgender surgery for completely normal individuals. He didn't mean that. Although the fatwa is ambiguous, that's why people need to make this clarification. And I just wanted to point out that there is a difference between the validity of the prayer and whether it's permitted, makruh, to appoint them as imam or to choose them to lead. This is part of khitab al-wada'. The validity or sahha is a different issue. So just keep this clear in your minds, that this is a different issue. The Sheikh was talking about the validity. Is it valid if it happened?
Okay, jazakallah khair. Tafaddal.
Assalamu alaikum. My question is, if we look at the fuqaha, rahimahullah, they consider that the physical abnormality for the khuntha. So do you disagree or agree that there might be abnormality, internal abnormality, let's say, on the level of chromosome? You mentioned that the chromosome is binary, but you mentioned that there might be some confusion in the chromosome level or in terms of the hormones. So do you agree that this is internal abnormality that can be taken or can be considered same as the physical appearance, the abnormality in the physical appearance? Also, the other question is, what are the percentage of those who are in this field? Jazakumullah khair.
So for the percentage, I don't remember offhand. Maybe Sheikh Hatem knows. Sorry, the first part of the question was about the khuntha and abnormality on the chromosomal level. So yes, it is possible that there is ambiguity internally, not externally. Actually, one of the fatwa which we quoted in the paper makes reference to that. Someone came to the Mufti and asked a question, and in the reply, this was stated that you should undergo further investigation by the experts, medical experts, and diagnosis. And if it turns out that internally you are a woman, then there's, it would be permissible for you to undergo this male to female surgery. About the what percentage of people on this category, Dr. Hatem may know better. He's a medical doctor. I am not a medical doctor.
I don't know the exact numbers for people with ambiguous genitalia. I know that true hermaphrodites, that's the politically incorrect word now for intersex person, but it used to be true hermaphrodite in medical literature. So you have true hermaphrodite, and then you have people with ambiguous genitalia. True hermaphrodite is the person who's half-half, half male, half female in every regard. And as the Sheikh explained, there are layers. There's the chromosomal layer, gonadal layer, and then internal genitalia, external genitalia, and behavioral. So the true hermaphrodite was about 1 in 25 million people. So extremely, extremely rare. But people with ambiguous genitalia, I don't remember the numbers for them.
Type. Just as an additional comment, I have read some literature where a very broad definition of intersex amounted to maybe 2% at the most. And that was using a very broad definition, just as a point of reference, inshallah.
Is it you want sisters? Check sisters.
It's right, left, and then.
Right. Bismillah ar-Rahman ar-Rahim. My question is directed to Dr. Hatem. Jazakallah khair. You have mentioned in your paper about mukhaddirat and muskirat, the opiates or narcotics. Dr. Hatem, this is for you. So, yes. You have mentioned in your paper about mukhaddirat and muskirat, like opiates or narcotics and al-muskirat. So my question to you, as we all know, this might be badihi and well known, that the sedation and, in terms of Muslim physicians, Muslim patients, and you have all the specialties, anesthesiologists, proceduralists, surgeons, they all use those opiates, narcotics. I don't remember in your paper you have mentioned, this is something that's accepted already, generally fiqh-wise, and for the Muslim patient as well. So both, Muslim physician and Muslim patient. Jazakallah khair.
Well, this will be the topic of the next talk. We will be talking about this. So I wish you guys ask me more questions about Muslim physicians prescribing haram medications for non-Muslim patients, because everything is coming. but that particular aspect of will not return. But when it comes to narcotics, the quick answer is the use of narcotics within the standards of the profession, within professional standards, is permissible. The use of narcotics for medicinal purposes, given that the standards of the profession are basically adhered to, is permissible.
تفضل.
Assalamu alaikum. Quick question that actually spans the previous two talks together. So with regard to the gender identity issues, the current guidelines and pathways for physical physicians, how to handle these cases are completely different than our religious views, as you can imagine, especially in the West. What is the role of a Muslim physician who is pushed into making decisions for these patients? If they can't refuse, as you can imagine with the current environment, it might be completely difficult for a Muslim physician to say, I don't want to see this kind of issues. What is the role for such a physician from initial consultation with as a pediatrician or an endocrinologist for hormonal treatment or other parts of management of these patients?
And I'm not quite sure if you're talking about a Muslim patient or a non-Muslim patient, but at any rate,
It applies to both, I guess, right? But
yeah, the distinctions between Muslim and non-Muslim patients are not that great, and oftentimes it will end up being the same, same considerations for Muslim and non-Muslim patients. The only difference for non-Muslim patients the difference is, I think I mentioned them at the end of my paper on prescribing non-halal medicines for non-Muslim patients. But when it comes to your counseling, people who want to change their sex, for instance, when it comes to performing the surgery, this would be still haram. It would be still haram to misguide your patient or tell them things that you do believe to be untrue. It is still haram to perform a transgender surgery on a completely healthy individual. Now, if that becomes a requirement of the profession, where if you don't do this, you will not be able to basically maintain or to keep your license, then there would be some room for flexibility there, and the particular scenarios will have to be addressed through collective ijtihad, through like fiqh councils and collective ijtihad. For instance, I mentioned in the paper about prescribing for non-Muslim patients assistance with merciful death or early termination of life for people who have terminal conditions. So I talk about this, and I talk about the potentiality in the future that this may be required of Muslim physicians and may be no way for them to opt out of it. Up until now, even in Canada, there are ways for them to opt out of it. If there is any way to opt out of it, then that would be fine. If there is no way to opt out of it, do we have any room to say that بين الفعل وبين المعصية فعل فاعل مختار آخر? Between your prescribing and the actual معصية or the actual sin is the action of a choosing willful agent. And if this is the case, then according to Imam Abu Hanifa rahimahullah, if there is like basically a buffer between you and the actual ma'asiyah, and this zone basically is the action of a willful agent. You prescribe the medicine for assisted death or whatever, suicide, and the person may or may not take it. That is فعل فاعل مختار. That is the action of a willful agent. In this case, there may be room to discuss things of that nature and to allow them, because at the end of the day, you will not ask all doctors, all Muslim physicians to quit the profession, and you're not going to make medical practice haram for doctors all over the place. But the ruling, if there is any way for you to opt out to avoid telling a patient, misguiding a patient,
10 seconds,
giving a
please.
patient false information is haram, performing the transgender surgery is certainly haram.
Jazakallah khair.
Sisters, questions?
Assalamu alaikum rahmatullah. Dr. Hatem, to follow up with the previous question, particularly regarding counseling and therapy. So talking about gender identity with Muslims versus non-Muslims and the legal, because of especially legal ramifications, how would a therapist or counselor or coach address those? Jazakallah. Well, especially licensed therapists. Jazakallah.
How would a therapist?
This one might be better for Dr. Suheil, I think.
I didn't hear what.
It was for a licensed therapist counseling somebody that's considering gender change and things like that, the applicability of it and how to approach it.
Well, I have to tell you that I may not be able to give you a very sort of nuanced answer because I am not a therapist. Therefore, I don't encounter those cases. So my answer will be basically crude, not nuanced. So haram is haram. I mean, you can't tell a person that switching their gender is a good thing because you know that it is not a good thing for a healthy person that is completely normal to switch their gender is haram in Islam. As a Muslim therapist, the fact that even if it is a non-Muslim patient, you can't really misguide them. You can't mislead them. Now, whatever necessities or like hardship that you may encounter because you're telling the patient the truth, you need to figure out how to basically manage that sort of contentious issue. You need to figure out how to do it. Taqullah mastata'tum. The only thing that I can say now is taqullah mastata'tum. Fear Allah as much as you can, as much as possible. So do your best to be, committed to your values, to your Islamic values, without losing your license. And taqullah mastata'tum. Fear Allah as much as you can. That's the only thing I can say.
Dr. Suheil, did you want to add anything?
So if you are a therapist yourself and you need practical guidance, I would suggest you speak to Dr. Suzy Ismail of Cornerstone. Either her or someone else who is working with her.
Just as a point of reference for the sister and anyone else that might have questions around that area, Monday there is a session on mental health for those of you who signed up for the seminars. Dr. Rani Awad, who is a very proficient professional in the mental health field, she might be a great person to ask. If you're here on Monday, I would suggest talking to her. If not, you can look her up at the Stanford Institute, Omara Stan, if you're not familiar with it, inshallah. فليتفضل.
Jazakallah khair. Assalamu alaikum wa rahmatullah. So my question is for you, Dr. Suheil, barakallah fiqh, and also this is for the panel, I guess. I hear it a lot, subhanAllah, about and you mentioned that thinking and having the feelings is not sinful. Can we reconsider this if we compare it with thinking about zina, for example? It's not the same abnormality or abnormal relation to normal relation that could be normal in human thinking. So I think there's a connotation that is brought with saying thinking about that is not sinful. And I understand that there's a therapeutic counseling effect from that. Can we speak about this? Can we reconsider this? Because again, on the minbar, in a fiqh standpoint, we cannot just tell the people and the masses that this is not sinful. Perhaps skipping that point would be more effective, especially for the youngsters. Jazakumullah khairan.
So yeah, I think the word I used was having the feelings, which is different than thinking. Yes, having the feelings, if a feeling or thought comes into your mind, you typically do not have control over this. But yes, you are responsible for how you deal with that feeling. Do you encourage it or try to get rid of it? So yes, I think it is important to actually make this distinction with your community, because there are people who struggle with these feelings. They don't want to have these feelings, but they have them. So it's important for such people to know that they are not committing a sin. Rather, if they are doing their best to get rid of these feelings and they are not acting on that, then they might be better than you or me, before Allah. One of the Imams was telling me that there was a brother who used to be there every day for Salat al-Fajr. And then after months, years, eventually he got the courage to come to the Imam and tell him that this is the way I feel. I haven't done anything haram, but this is the way I feel. So can we say man is sinful? No. He's doing his best to avoid the sin. But yes, if you encourage that feeling and if you think about doing the act, just as for a regular heterosexual person to think about doing zina is a sin. So similarly, to actively think about performing liwat is a sin. But as I said, we need to distinguish between the feelings and the thinking. Allahu Alam.
Sheikh Hatem, did you want to add anything?
So من هم بسيئة فلم يعملها كتبت له حسنة. إن الله تجاوز لي عن أمتي ما حدثت به أنفسها ما لم تكلم أو تعمل به. That's basically the essence. Allah had pardoned this ummah for their inner thoughts as long as they don't act upon them or speak of them.
Right.
And ilham is a qadiyya that is, certainly when you basically intend to do like a ma'asiyah, and then you're prevented, you repented or you reconsidered, then you get rewarded. But if you intend to do the ma'asiyah and you're prevented by external forces, then that is actually blameworthy, and that is sinful, because you have embarked on the ma'asiyah, but you're prevented by external factors. But if you are keeping yourself, even if you have the intention at some point, but you are resisting, and you have internally kept yourself from the ma'asiyah, you get rewarded. So.
Alhamdulillah. For the sake of time, that will have to be our last question for this session. The next session will start at 10 o'clock promptly. I want to give you guys the 15 minutes for a break. And then again, there is an open discussion session at 11:30, from 11:30 to 12:30, to ask all of your questions about the sessions in question. I just want to close with one observation regarding what Sheikh Hatem was just mentioning. Barakallahu feekum, that was exactly the same hadith that was in my mind. It's important to understand from the standpoint of ourselves as imams and therapists and things like that, etc. If somebody is coming to us with struggling with these issues, to talk about it with us, this is something that they shouldn't be blamed for. They're speaking about it, yes, but they're speaking about it in a context where they're seeking guidance, they're seeking advice and support. So this is something that actually is praiseworthy in a certain sense. And so we need to understand it from that perspective. Wallahu ta'ala a'lam. جزاكم الله خير سبحانك اللهم وبحمدك اشهد ان لا اله الا انت استغفرك واتوب اليك. السلام عليكم.